You want to know if alopecia areata is curable. That's what we're going to be discussing today. This is Dr. Dwella Moten-Nelson, your healthy scalp specialist. The short answer to that is yes, it is curable. The long answer is most of it is not, because people wait for such a long time to seek treatment. So, perfect example, there's a little girl that doesn't live too far from us. Her mom called and she said, hey, my daughter, she has beautiful, thick growing hair. And I saw this bald spot at the top of her head. And we have some images of that little girl. But she's a grade schooler and she had a little small bald spot, maybe the size of a dime. And then a couple of months later, the mom called back and said, my daughter, this bald spot is getting bigger. It's now the size of a quarter. Do you have anything for it? I'm going to go see a dermatologist to let them look at her scalp. But I just wanted to call you because I know that you do a lot of natural things for hair and scalp. And so, I told her, I said, well, let me look and make sure that the things that I would suggest for her are ideal for this particular situation. In the meantime, she did go to see a dermatologist. When she went to see a dermatologist, she said, Dwella, I went to see this dermatologist and she wants to do injections to my baby scalp. And this mom she did not want to do that. She was really nervous about it. She wasn't sure how her daughter, who was a grade schooler, was going to react to that. And it was supposed to be very painful as well. So she didn't want to have her daughter experience pain where she didn't have to. And so we ended up using Alopecia Repair Balm, the growth kit with the derma roller. And the pictures that are shown below will show essentially, well, she used that for a couple of months. And it took maybe a month or so before she started to see some hair start to come in those bald spots. But in a number of months, with less than 4 or 5 months, that entire bald spot had grown in. A lot of clients will call and say, I saw my hair falling out 5 years ago and I didn't do anything about it. And now when they come to me, they have more of a very slick kind of balding on the scalp where you can't see any follicles, you can see into the pores. It's essentially like looking at, if you think of an orange, the peel of an orange is how you would think of your scalp if you had pores that were visible. If you think of the outside of an egg, that is how your scalp looks when your follicles have gone dormant. By the time you get to the point that your follicles are dormant, like the surface of an egg, for instance, your follicles are usually dormant and they're not going to produce hair. Now, science has definitely moved forward in that area where you have people that their hair is not growing back at all. There's actually a method that they can use to do injections to the scalp, and they are called PRP injections. You have to go in for a series of injections. There's a couple of doctors around the country that do this. I will tell you, it's a very painful method to try to get your hair back. They don't guarantee you that your hair is going to grow back. But many people, when they go to do it, even though that's to the extreme, that's a method that people have found to be very helpful. But for one, it's quite expensive. And for two, it's very, very painful. I always, like I mentioned before, I always recommend if you can start to treat early and get your hair to start to grow back before you get to that point where your hair is all gone and the scalp is looking more like the smooth surface of an egg. If you can get started as soon as you see that hair loss, you have a better chance of growing your hair back in. Again, please subscribe, ring the notification bell button. Join us, follow us here for more information. And if you have questions, please make sure that you drop those questions below. We are happy to get your questions, excited to see what your questions are. And if you are liking our videos, please continue to share our channel with others. And thank you for listening. This is Dr. Dwella Moten-Nelson, your healthy scalp specialist. Thanks.